Now, regarding left anterior fascicular block, just as a reminder, we know that the left bundle branch is dividing into the left anterior fascicle, and the left anterior fascicle usually go to the lateral free wall here. And there is a left posterior fascicle which goes down on the septum and start originating the electricity at the apex, like inferiorly in the septum. So what happens now if we have a left anterior fascicular block? This left anterior fascicle is not working anymore. So the electricity will actually reach the left ventricle from the left posterior fascicle first. So the electricity will originate here. Now, let's just remind us that we have the inferior leads here, which are the lead 2, AVF, and lead 3, right? They are looking at the heart inferiorly. And we have the lateral leads here, mainly lead 1, AVL, and V6 and V5 and V6. Okay, so they are looking at the heart from here. So what happens now? If the left anterior fascicle is not working anymore, the electricity will reach first on the left posterior fascicle, and the electricity will generate from here. So initially, the electricity will go downward like this, right? So the inferior leads will perceive the current is coming to it, right? The electricity is coming to it. So it will give us a small R wave, And after that, when we are looking at the lateral leads here, the electricity is going away from them. So we will have a small Q wave. Okay, after that, the electricity now will disseminate everywhere and will go to the full muscle, to the whole part of the muscle. So the axis will go to the other side. So after that, if we look here, the electricity is going toward the lateral leads. So we will have a R wave, and the same electricity is going away from the inferior leads, and this will give us a S wave. So, and these are the criteria, that's it. So what are the criteria again? In the lateral leads, we will see a Q wave, small q, and a large R. And in the inferior leads, we will see a small r and a large S, R S capital, like this, R small S capital. So these are actually the criteria here. The other thing is, this is the left bundle branch, right? It's a block in one of the bundle of the fascicles of the left bundle. So left axis deviation will be evident. So let's talk about the criteria. Number one, we will find R small S capital in the inferior leads, lead 2, 3, and AVF. And we will have small q R capital in the lead 1 and AVL and the lateral leads. And we will have left axis deviation on EKG. These are the three criteria that will tell us that the patient is having a left anterior fascicular block. One additional feature that actually differentiates the left anterior fascicular block from like left bundle branch block or right bundle branch block is that the QRS complex duration is near normal. It's either normal or near normal. Like it means that the QRS complex duration is less than or equal to 3 small squares. Let's have a look at EKG here. And let's talk about the diagnosis here. So first, what is the axis? Again, the axis is very easy thing, right? We look at lead 1, it's positive. We look at AVF, it's negative. So they are going away from each other. So this is left axis deviation. And whenever you have a left axis deviation, you have to ask yourself, what's causing this left axis deviation? Let's see here. If we look at lead 2, 3, and AVF, we can see there is a small R wave, and a deep S, right? This is R small capital S. And if we look at the lateral leads, which is lead 1 and AVL, we will see the opposite. We will see like a small s with a large R, small q with a large R. So it's q small R capital, okay? And if we look at the QRS complex duration, it's almost 3 small squares, maybe like 2.5 small squares. So it's not enlarged, it's not prolonged, right? So if this patient is having a left anterior fascicular block. And thank you.